The Bay Area might be in for an extended coronavirus lockdown as the number of cases continue to rise. And now all efforts are aimed at slowing the spread and fast-tracking a vaccine. And joining us now by FaceTime is Dr. Malathi Srinivasan with Stanford Healthcare, here to talk more about the coronavirus. Good morning, my friend.
Good morning, Michelle.
All right, it is good to see you. So let's start talking about this. First of all, how long can it live on surfaces?
So coronavirus can live in the air probably for about 3 hours. And on surfaces, it lasts on copper for about, a lot of metals for about 4 hours, on cardboard for about a day, and on plastic for up to 3 days. This is because the coronavirus has a bit of a fatty layer over it. And it's pretty easy to dry out. So, for instance, if you were to take a mask, everyone's sort of concerned about reusing masks these days, since that's one of the personal protective equipments that's such in limited stock. If you take the mask and put it on in an oven for about 30 minutes, somewhere between 150 to 170 degrees, you can very easily kill this virus. So it's not a very hardy virus in the sense that there's lots of things that we can do to stop the spread, at least locally on our surfaces. But very important to disinfect your phone.
Yeah, that is very important. I wipe down my phone constantly throughout the day. Okay, so let's switch over to a different topic. President Trump, of course, extending the social distancing guidelines to the end of April. Previously, though, he has said that he had hoped to relax those guidelines by Easter. I'm just wondering, did you agree with that assessment?
Well, I think the decision to lift the restrictions needs to be based on the science of whether or not we're bending the curve. So the way we know if we're bending the curve is if the number of people, so ideally you're going to bend the curve when the number of people that any infected person infects is less than 1. Right now, uncorrected, because this is a very contagious virus, as I'd mentioned, it lives in the air for a couple hours. It's pretty easy to pick up. We think it's about 3 or 4 times as infectious as influenza virus, but not as infectious as measles, say. Right now, the number of people that any infected person without social distancing is going to infect is somewhere in the range of 3 to 4. And we know that with social distancing, at least in Seattle, we've got data now that shows it's around 1.6. We start bending the curve when the number goes less than 1. And so I think it's too early to tell. We started social distancing in the Bay Area on March 17th, for instance. And it takes about 2 weeks for, let's say, someone who's infected to show up. And then after that, another week or so, maybe a week and a half, for the people who are going to get very sick to get truly sick. And so we're not going to know if our efforts are going to be working probably for another 2 to 3 weeks. And then after that, we've got to give time for the spread to really diminish. So I think that a reassessing at the end of April is probably the right thing to do.
Gosh, it's so interesting when you said this all started March 17th, because it seems like it's been going on forever.
It does, doesn't it? Exactly. Yeah. Our lives have changed so dramatically.
Yeah, you're absolutely right. Okay, so we know the virus. We know it's especially dangerous for seniors, but apparently there's been this spike in cases in younger people. So how dangerous is it for younger people?
Well, I think the main point I want to get across to our viewers is this. Nobody should be complacent. Everybody potentially could get a serious illness. Now, that being said, the majority of people, 80 to 90%, most likely are going to get a very mild illness or just a standard, not so pleasant flu. But of the people who are getting hospitalized, the CDC had released some data from case series, which again are a little bit hard to interpret because they're very local. And about 50% of about 120 people who were admitted to an ICU, about a little over half of them were over 65, which means 45% of them were under 65. And of them, about 30 to 40% were above 45, and the rest of them, 10 to 15%, were under 45. So, these are important numbers to remember, because I think that we just all need to practice social distancing and all of the good hand hygiene and not touching our faces that we've been talking about for the past couple of weeks.
Sure. Well, what do we know about these anti-malaria drugs that the White House says were recently approved by the FDA?
Right. Well, it's important to note that there's lots of medications that are being studied to treat coronavirus. And personally, I'm optimistic that we're going to have something in the near horizon. The hydroxychloroquine and chloroquine are both medications that have been used for malaria since, chloroquine has been used for malaria for decades. And hydroxychloroquine is a well-studied medication that's been used for rheumatoid arthritis and for lupus and a bunch of other autoimmune disorders. So we're really familiar with them, and they're available over the counter generically and in pill form, so they're not IV. The hydroxychloroquine was studied initially in China and in some other countries when SARS came out. And it showed some effect, but not necessarily as much as people may have wanted. But for this particular virus, both hydroxychloroquine and chloroquine, the malaria drug, seem to have initial efficacy. They've already been, chloroquine's already been approved for use in China, in India, in South Korea. Hydroxychloroquine is being studied now in the U.S. and a bunch of different studies. There's been some preliminary case series, both in China and in France, that have shown initial efficacy. Now, the problem with case studies is this. That basically means like you treat a bunch of people with something who come in with a particular problem. But because you're not selecting and randomly assigning the medication to one group or the other, you can't really compare whether it's working compared to the general population, because people are usually choosing those drugs for a reason. So case series has a lot of problems with it in terms of saying, there's hard science behind it. Case series are very helpful to be able to create a hypothesis saying this might work, and then you do better tests and better trials in controlled settings to really see whether it's a fluke that it happened or if it's real, but the data is very promising. And as you may know, New York City just ordered 70,000 doses of hydroxychloroquine, 750,000 doses of chloroquine, and another 10,000 doses of azithromycin, based on the initial French study that, it had a small number of people, a couple hundred people, and they had compared patients who had gotten hydroxychloroquine and azithromycin to people who didn't, but the people who didn't were both people at another hospital who didn't have access to the drug, and then also people at their own institution who had decided, or for some reason were ineligible for the drug. So it's comparing two different populations like that and coming up with really strong, generalized outcomes or statements that you can really make decisions on is tough.
Yeah, it sounds
so.
like.
I think that the message is that there's lots of promising things on the horizon, including remdesivir, which is an IV medication, and then a French medication made by Fujifilm, which is favipiravir, which is, I always pronounce that incorrectly, so sorry to Fujifilm. But that's an oral medication that's made in Japan and has been approved for use in China and hasn't been studied as much yet in the U.S., but I'm sure those trials are coming. And the other really big news is that the WHO has a trial called Solidarity that's looking at 4 different combinations of drugs in over 20 countries around the world. So it's going to be a huge multi-center trial. So I think there's a lot of good things coming. I think we're just going to have to be patient and wait.
Yeah, it is good to know these trials are going on right now. Thank you so much for all of that information, Dr. Malathi Srinivasan with Stanford Healthcare.
Well, thank you so much, Michelle.
Yeah, good to see you. And every Monday, don't forget, we will have a physician from Stanford join us to talk about the latest on the coronavirus. Still ahead, it could be a game